Chairperson of the Aryan Benevolent home in Pietermaritzburg, Dev Naidu, says they have since implemented strict lockdown regulations to safeguard all their residents.
We've gone into lockdown 5 phases, whereby we've totally locked down the institution. There's no persons allowed onto the premises. We've got people properly socially distanced in the unit itself. We've got PPEs in place and masks. We're giving the residents the zinc, vitamin B, vitamin C, vitamin D, and supplements as well. Part of their home has been now changed to a little clinic where the sister has managed to secure oxygen and other apparatus that are required to monitor and treat the patients here. And Dr. Bishop and his team from Grace Hospital are on call.
Naidu says they have received support from both the provincial departments of finance and health in order to reduce infections at the home. However, he says they are in dire need of basic necessities such as groceries. Naidu is also appealing for donations of recreational items to help keep the elderly residents occupied during the isolation.
There's a great deal of anxiety amongst them. Some of them don't have families, so they've got no one to turn to. So we try to support them as much as we can. We need some sort of recreational goods like maybe carrom board or a wool for the ladies to knit and anything that will keep them occupied, even like beads. We can do some bead work as well, just to take their minds off the pandemic. Quite a few of them are now going to be placed into total isolation. It's a very, very sad state of affairs. It's as though this pandemic is attacking these poor old people whose lives are not very, very good as it is. And it's actually made it even worse.
In Durban, the Association for the Aged, TAFTA, has confirmed another 2 cases at their facilities. This brings the number of cases to 28, of which 22 are residents and 6 are staff members. 2 residents have succumbed to the virus, while a third died after a procedure after recovering from COVID-19. TAFTA CEO Famida Shamam.
Of the 22 residents who tested positive, 14 have recovered. We unfortunately noted the deaths of 2 of our residents. A third resident also passed on. She initially tested positive, went into hospital, had a second test done and came out with a negative result, was then readmitted into hospital for a medical procedure and subsequently passed on. That takes it up to 3. In terms of our staffing, with our 6 positive cases, we've had 3 of our staff members that have recovered. So currently we have now 3 more that are isolating and we're monitoring for symptoms as well.
Meanwhile, as many elderly South Africans face isolation, clinical psychologist Dr. Sherona Rawat says it is critical to find ways to emotionally connect with them through the trauma. She says in cases where the elderly are unable to use technology, people can reach out to the staff to offer assistance.
Connect with the staff at the facility and ask them to assist you in actually making a phone available or helping that patient manage their telephone or their cell phone so that they're able to actually speak to family. Get your children to draw pictures and things, take pictures of it, send it through to them. If they have WhatsApp, keep in touch with them with WhatsApp, use video calls to give them the opportunity to vent some of the things that they may need to vent, to speak to you about certain things that may need to speak to you about. When individuals are ill with this virus, a lot of individuals, irrespective of their age, actually are looking at their mortality.